So this is our morning case where maxillary right lateral incisor was broken. You can see the post, but it is broken badly. So I decided to remove the post first, and after post removal I am preparing a shield. So for shield I have sectioned root mesiodistally, and I have successfully removed the palatal portion, and it has come out along with periapical lesion. I want to show you the tooth. And you can see here the periapical lesion is associated with this root, and how I have sectioned root. You can see here the palatal portion or apex should be always the part of the palatal portion that you are going to remove. This is most important part in socket shield. If you are able to section your root in this way, half job is almost done. So now the buccal portion of root is attached with the labial plate. I will reshape it and place implant palatal to it. That's it, job done. You can see the shield over here. It is 1.5 to 2 millimeter thick, 3 millimeter below the gingiva, and the length of shield is around 7 to 8 millimeter. So all parameters are achieved. Now we will start with osteotomy. And this is first drill, and you can see how beautifully it is just piercing the nasal floor. So my target is to engage the nasal floor with maybe 4.2 by 13 or 3.75 by 13 millimeter implant. The diameter will be selected according to the jumping distance. I will see to it that after placing 3.75 or 4.2, I will have less than 2 mm space between implant and socket, and at the same time I have to see that my implant is not touching the shield. That's it. So we have selected 3.75 by 16 millimeter because after placing 16 millimeter, my implant will be 3 millimeter below the crest of the socket. If I place 13 mm, it will be 6-7 millimeter. So that is how you have to always select the length, so that your implant will be either 3 or 4 millimeter below the crest. And in immediate implant cases, the most common length is 13 millimeter. This is 3.75 by 16 mm implant. You can see about 2 mm space between implant and shield. So we will place gingival former. Patient will be given RPD as a provisional, and after 3 months we'll load it. So after gingival former placement, you can see there is a 2 mm of space between tissue and gingival former. As we are not giving any implant supported provisional, I need to close that space. So what I will do is I will labially over reflect the tissue little bit here from here, and I will give 2 sutures. It should approximate this space completely. Show this. Chalo, done. And you can see the labial gap is completely closed. The keratinized tissue is adapted around the gingival former with the help of 2 sutures. And this is our final X-ray showing the engagement of implant just below the nasal floor, and placement is superb. It is around 3 millimeter below the crest, and there is a good space between shield and implant. All the parameters are achieved in this case.